Hi, I'm Dr. Nabil, an NHS GP based in Manchester, and I'm on a mission to make evidence-based medicine available for all. Today, we're going to be talking about psoriasis. Now, what is psoriasis? Psoriasis is a very frustrating skin condition, which a lot of patients can find embarrassing. And often it can start a bit like eczema. So you can get dry, inflamed patches all over your body. It can be in your hair, your face, your arms, your legs. It can cover large parts of your body and even small parts of your body. So what are the treatments for psoriasis? 1. Fluid balance. Now, this is very important. You need to make sure you're having enough water throughout the day. And if you're having anything that's going to deplete water from your body, so things like excess caffeine, you're going to be exercising, you've had diarrhea or vomiting, then make sure you're replacing the fluid as well. And electrolyte tablets can be very, very handy. This in turn will ensure that your skin health is optimized. 2. Moisturizers. So with psoriasis, you need to ensure that your skin is well hydrated and moisturized regularly. For some patients, you might have to moisturize up to 6 to 8 times a day, and you need to find the right moisturizer that's giving you the right level of coverage. So what I mean by this is, if you're using a moisturizer and within a few moments it's dry again, then you might want something that's a bit more greasy in terms of your moisturizing cream, and your clinician can help you with this. Number 3, steroid creams. In psoriasis, sometimes moisturizing is not enough. You might actually need some steroid creams for a short period of time. Now, what steroid creams do is they reduce the inflammation and some of the kind of autoimmune processes that are occurring on the skin. They can improve the redness that you see in psoriasis. You may be advised to use this up to once or twice a day, depending on the strength of the steroid and where you're using it on your body. And usually you'll be advised to use it from 2 to 4 weeks, again depending where you use it. Now, one thing to consider in psoriasis, especially if you have plaque psoriasis, which is when you have a white scale on top of your psoriasis, sometimes the steroids isn't as effective because the plaque acts like a barrier to the skin that needs to be treated. So for patients that have this, it's advisable that you moisturize the skin quite aggressively, or even use things like oils. You typically see this in the area around the head or the hairline. You can get plaque psoriasis. So patients are encouraged to use some warm oils like an olive oil. You can warm it up, not too hot, apply it on the area, and then you can use a light brush to take away some of the plaque. Now, be careful, because if you comb too firmly or too often, you can cause some bleeding. But when the plaque is removed, it's now best to use the steroid cream because the skin is now exposed and can be treated by the steroid. Number 4, vitamin D analogs. Now, to treat psoriasis, vitamin D topical treatments can be very, very useful and very powerful for particular patients. You might find that your clinician has recommended you to take a vitamin D topical treatment on its own or mixed with a steroid, because together they can be a lot more powerful. Depending on which area your body is being treated, you might be recommended different types of treatments, so be aware of that. Number 5, shampoos. So if you have psoriasis in your hairline or inside your hair itself, you may be recommended to try some shampoos. Now, this is better than creams because it's very hard to apply creams within the hairline, and often it can stand out and be quite unpleasant. With the shampoos, there's different types of shampoos, and for each patient, a different type of shampoo may be more effective. You may have to trial a few with your clinician to get this right. And each treatment also has different instructions. Some you will use a few times a week, some you will use daily, but they can be very effective in helping improve psoriasis within the hair. Some of these shampoos you can buy over the counter or online. To name a few, you have Nizoral, which is an antifungal one that's very effective in psoriasis. You also have Polytar, T-Gel, Capacel. There's multiple options that can be very useful, but you have to find the one that's right for you. Number 6, mental health. Now, this is an area that's not often talked about when it comes to psoriasis, but what we do know is when you have a skin condition like psoriasis, depending on where and how it affects you, it can cause you to feel down and depressed about your condition and your outlook. Now, if your mental health is not being treated and you're not managing it very well, this can actually cause like a domino effect and make your psoriasis worse, because you're more likely to have less energy and less motivation. You're more likely to be down in the dumps, and some of your lifestyle habits could change. You might not sleep well, you might not be looking after yourself properly. All these factors can impact your psoriasis long term. So it's important that you reach out and address this with your clinician. What do you do if you have psoriasis? So you could follow some of the steps in this video. So aspects like making sure you're well hydrated, using some moisturizing cream that's not perfumed. However, beyond these points, it's useful to reach out to a clinician because they will need to assess the type of psoriasis that you have and how much of your body psoriasis covers, and then they can recommend what type of treatment is appropriate for you. Now, I know that psoriasis is frustrating to deal with. It can be very embarrassing. However, if you reach out to your clinician, they can give you the help that you need. I would really appreciate if you like and subscribe to our channel. And also, if you want to find out more about other health topics, why not check out our channel? Thank you for watching.